Good morning and welcome to the June, which I can't believe it's already June, GDDS Analytic Advantage User Group meeting. We appreciate you taking the time out of your day. This is your time for us to go over any updates and for you to ask questions and give us feedback. So please feel free to unmute yourself if you have a question. Again, we are recording this, and the recording and the slides will be available later this week or probably next week in the Member Data Services Member Resources section of the GHA website. So we'll get started. We've got several pretty full agenda today, and we'll kick it off just by, as we always do, going over our Georgia Discharge Data System and what that is for folks who aren't aware. The Georgia Discharge Data System, we are the vendor for the state. The state requires all hospitals to submit their inpatient and outpatient data, and we are the vendor for that. They submit to our partner, our sister hospital association, Missouri, and they have a subsidiary, Heidi, is our vendor for the data submission portal. The data is submitted in the UBO4 data format, and then it is taken through a series, quite a few edit checks, both that are run automatically, but also there's a human side to that Sharifa runs through and looks at a lot of verification reports, and then it becomes the Georgia Discharge Data System. And on your behalf, we submit that to the Brain and Spinal Trust Fund Commission, the state of Georgia, the Agency for Healthcare Research and Quality for research purposes, and the Healthcare Cost and Utilization Project. We, also, again, you have the outward-facing tool, the Advantage Optics, where you have the capability of running your own reports on the de-identified statewide data for a historical time of about 5 years. And Sharifa, do you want to cover the 2021? We're wrapping 2021 up. And Sharifa?
Yes. Good morning, everyone. So this is the submission schedule, for 2021, and we're wrapping it up during our Q5 release, which is the final release. In mid-July, we're expecting all of the resubmitted data to be in, all the corrections to be made, and we've been working with some of you who had some issues with data volume or distribution, to resubmit that data by July 15th is our target date. And by the end of July, we'll be able to, close that database for good. And so I'll have a final report where if there are any issues that remain unresolved, we'll have an explanation for this, but hopefully the data will be as clean and valid as possible by that date. And also here, I've included out, and I'll email that to you as well in a few weeks, but this is the checklist that we recommend that all of the either data submitters or the data reviewers in your facility go through to make sure that your data is, like I said, valid, and the volume and distribution of your demographics and your swing beds or patient types and all of that is correct. And so, this checklist makes sure that you have all of your race codes, coded properly, ethnicity, because these main ones are the ones that will cause a fatal error when you look at your edit summary report in Heidi. And so the patient type, making sure your Medicare and Medicaid patients are labeled or charted properly. So reviewing your distribution for that and your verification report, making sure your swing beds and your psych or behavioral data is included. And, for swing beds, as many of you know, you have to use a separate NPI along with your correct bill type so that it shows and that's separated from the inpatient data. And also your MSDRG listings, reviewing that distribution. And if you go to the next slide, there's also the list of revenue codes that require CPT codes. So that's for your outpatient visits. And you can find that document under the documentation tab on HeidiNet. And here they are listed here. And so to make sure that everything is, you know, I guess, coded and distributed appropriately through your outpatient data. So if you have any questions about how to review that information, let me know. Again, the verification report in HIDE is a good resource for that. It kind of gives you a big overview, and if you see any issues, you can go within your system and make those changes before you resubmit. Any questions? All right, that's all I had. Thank you.
Thanks, Tarifa. And then on the 2022 GDDS submission schedule, Sharifa's added a couple of updates. Sharifa, do you want to cover those?
Yeah, the update here that we added under the final data available on the visualization of strategic planning tools. So the monthly data will be released 10 business days after the close of the database, since we switched to a monthly submission. And same thing for the limited data set for those of you who have or who participate, that will be also released 10 business days after the close of the database. So the data is due on the 15th of the next month. You know, we give you kind of a 45-day rolling period to submit the data, and then 5 business days later it's closed, and then we have another 5 business days to, you know, review it before we put it in production. And so that's where that 10 business days comes from, and that's when that those will be available here. And so for this month, on the 15th of June, the April data will be due. So I see that some of you have started submitting that, and quarter 1 has been refreshed and will be available early next week. It'll be in production. So if you have access to the Advantage Optics tool, which is our strategic planning tool, you'll be able to, you know, manipulate or, you know, use that data to run your reports for Q1 2022. And I'll also be releasing the notes to the study for that quarter, and that'll be under the data resources section on our website, so that you can look at, you know, any discrepancies for quarter 1, you know, and use that side by side when you run your reports.
Great. Any questions for Sharifa? Well, if you have any questions or comments, please feel free to use the chat box. We are monitoring that. So the next thing I wanted to talk about is we've been having some discussions with several hospitals asking us to review how the outpatient data is being classified. And what we were finding is that the outpatient surgery cases were not being as accurately reflected as they should be. And due to billing changes throughout the years, and this latest release, or the previous release, was from 2016, late 2016. So it's appropriate for us to review this and make this change. So the change that we're going to make is that, and this is from the patient type specifications document, which is also available on the website, and we will post an updated one. But we are changing this or where the record contains one of the following bill types and one of the following UBO4 revenue codes, or one of the following CPT HCPCS codes. We're changing that to an and, so that it has to have the appropriate revenue code and the appropriate CPT HCPCS code. So does anybody have any questions or comments? I know several of you, this is long awaited. And the good news is this is going to be retroactively applied to the final release of the quarter of the 2021 data. So when we release that in its final state, that will, you'll see some of those patient counts shift, the patient type counts shift to more accurately reflect the outpatient surgery cases. And also moving forward with 2022, that will be the case as well. Bill, did you want to add anything to that? Because you were in on a lot of those discussions.
No, I just think it was, we appreciate the hospitals pointing that out and telling us some of the new ways that they've been instructed to bill, either by, you know, Medicare, Medicaid, or their individual payers. So it was just one of those things where they were starting to add a facility charge fee that was really capturing some outpatient surgery cases, and we were grouping them as surgical cases. So we think this will be more reflective of the actual products and revenues that were being applied. So we're in effect overcounting surgical cases.
And I did have a question in the chat about the Q1 2022 data. That's already been released, or we already have that data set. And so with the April data release, which will be retrospective back to the previous quarter, we will apply that methodology as well. Any other questions? All right, Bill, I think this next one is for you as well.
Yeah, I just want to point out last week, and I know a lot of folks, we got a lot of out of offices last week. So if you did not get this check, obviously it was sent May 24th. This is proposed rule season. So we were able to put out a number of proposed rules that are out there. We get a lot of these from our partner hospital association up in New York State, Hospital Association New York State. They run a lot of these models as comparison to what did happen if these new reimbursement methodologies were in practice in a previous year. So we were able to put in the IPPS rule. That's the big one that everyone is typically looking for. The inpatient psych, rehab, and the long-term care rules. I think there's some others that we expect to come out in the next couple of weeks as well. Skilled nursing is in. All of the proposed rules also have their policy brief and the analysis in there. So if there's some unique things for your hospital, it may be reflected in the way that they did the calculation, which you could see in either the policy brief or the analysis. We've combined that into one. So if you see the policy brief, the analysis is behind that too. There are also a number of the quality updates that were done. Most of the proposed rules were done in the old setup, so they're just PDFs. The quality ones are mostly the new interactive website feel type of reports. The hospital acquired condition reduction program, the quality programs of overview, measure trends, and then the value-based purchasing analysis. So there was a lot put in your member folders within the last 2 weeks. So if you have not had a chance to go in there, or if you need someone else to have access to that, please let us know and we can get them set up as well. But these are the ones that most people have been waiting on. So hopefully everybody's able to download those. The other one that we're excited to release, actually it will be released. They're in your folders this week or right now, and we'll start releasing them with some additional context as the week goes on, is the economic impact report. This economic impact report is unlike any we've ever done before. We wanted to provide the numbers, but unfortunately, this is just the one that's heavily influenced by COVID. I don't know how much you're familiar with the economic impact report. They're usually 2 years in arrears. So the multipliers that we get from the Bureau of Economic Analysis, we'll talk about the 2020 data, and they've done it. One of the things that was a real eye-opener for us was when the Bureau of Economic Analysis actually put out an FAQ when we bought the multipliers, and it says multipliers, and I've got it memorized, their multipliers are not designed to estimate the impact of supply shocks on the economy. Well, 2020 was the definition of a supply shock to the economy. So we had to take into account, you know, what's the impact of you guys paying 7 times, 10 times as much for basic supplies in 2020 than you were paying in 2019. The household earnings would have been impacted because, you know, many of the counties were on lockdown and you could not go out and spend. So even though the hospitals were working and paying salaries, they could not spend. So that ripple effect was not going through the community. The other thing that we wanted to make sure that, and it's not in this example, this is the statewide report, but on your individual reports, we identify the fiscal year end. for the time frame, because that could have a very big impact on how much of the effect of COVID that you had. So we had fiscal year ends everything from 6/30/2020 through 6/30/2021. So kind of, you think about it, some of those hospitals that really and truly ended before, say, 9/30 of 2020, some may not have had an impact from COVID. They may have actually had to furlough some folks just because of the way it was impacting the various communities. Some that have a 6/30/2021 could have actually seen 3 waves of COVID, plus the beginnings of kind of the Delta wave. So we never wanted these reports to essentially stand on their own. We were providing all of the context to the numbers with them. So your individual report will have your fiscal year end at the top, and it will have a comparison of 2019's report to 2020, so that you can then decide how you may want to use that within your community. Again, if your community was on lockdown and you couldn't spend your employees couldn't spend the money in the local restaurants, movie theaters, then you may not want to use the total household earnings. If you've had to furlough folks during that time, you may not want to use the full-time jobs created, things like that. So we wanted to provide that context. So there's this snapshot, and then actually down at the bottom, there's even some of the more detailed descriptions of how you could use it and the factors that may influence the economic impact. So just to give you a quick overview of the numbers, the total expenditure, $30.9 billion. That's actually almost a 9% increase from 2019. The total output was 70.2 billion. And so that even reflects a reduction in the multiplier compared to 2019, and it's still a 7.6% increase. The big one that everybody's going to look at is the payroll and benefits. $15.2 billion in payroll and benefits. And so that would include overtime, that would include contract staff, that would include any of those types of things that hit. That's actually 25% higher than 2019. And the FTEs actually fell by almost 3%. So we actually had 5,000 or so less FTEs in this report than we had in the previous. I don't think I touched on it, but the FTEs, we get that from the hospital questionnaire. And that is a snapshot in time. So it says, I think I've got the question right. It says, as of December 31st, 2020, what were, and it broke it down. It's budgeted FTEs, vacant FTEs, filled by contract staff. So that is a snapshot in time. And 12/30/2020 would have been right in the middle of some of the I guess, euphemistically called kind of the holiday wave of COVID, where there was a real significant increase in discharges in December and January. So that number, even being 5,000 less than 2019, could actually be over accounting based on what was going on in the market. So those are in your folder. And like I said, the big distinction that we have different from this year to last is that we're just trying to provide the context so that you can do your own explanation of the numbers. We don't have the 6 or 7 page narrative like we've always done in the past. Just didn't think it was possible to make a realistic accounting for hospitals' impact on GDP when we didn't know, what the state GMP was like. We usually do a comparison of your total jobs to the total jobs in the community. Those numbers just did not look right when we start using the 2020 survey that the state does. So this one is a little more just raw numbers and context to let the hospitals describe what happened in their own shops and how they were able to impact the community from a health, economic, and employment standpoint in the middle of COVID. So I'll be more than happy to take any questions, but they're in your folders now. And we'll be sending out an email with this specifically this week.
Does anybody have any questions or comments for Bill? All right.
Thanks, Leslie.
Thank you. So again, we are in, I guess, about full month, see, April, May, starting our third full month with Advantage Optics. And we hope that all of you have had the opportunity to log in and explore and utilize the tool. Just wanted to remind everyone why we moved back to the HIDE platform for Advantage Optics. It's one platform, all of our data that you submit, it's all in one place, and just makes it a smoother transition and a faster transition to report the data back to you. It is a Tableau-based tool, and you have the capability to save your own dashboards and your own reports with your own specifications. There's flexibility with the dashboards. You can have, images that you download into presentations or PDFs, or you can download data to manipulate the way that you want to. Monthly data updates, which I think is one of the best things that we do have going. Currently, February is in the data, or is in Advantage Optics, but by early next week, it'll be the full first quarter of 2022. There's advanced filtering, and again, there's a custom tab where you can do your own data download. You can save again, you can favorite dashboards, create your own group. We have DRG groups that are going to be added. You can start with your own template if you want to define your own service area by creating kind of a starting point, and I'm going to show you a couple of ways to do that in a few minutes. And then outpatient groups. So a few updates from some of the things that we've learned and that we've been in discussions with HIDE. The inpatient DRG service line groupings will be added in mid-July. That is being programmed currently, and I know a lot of you are anxious for that. And there is a way to go in and program that yourself if there are specific DRG groups that you really need to focus on now. If you need to look at your cardiology services, things like that, we can walk you through how to do that on your own for your service area and save that. Also, the outpatient service line groupings that we previously had, those are going to be added back in place of the CCSR body systems. The CCSR body systems are really more applicable to the inpatient data. So those will remain the CCSR body systems in the inpatient dashboards, but will be taken out of the outpatient, and the previous version of the care service line groupings for outpatient will be added back in. And there's another thing that's going to be added, with the next week's data release, and that is, and Bill, you may have to chime in on this one, that we participate, HIDE has multiple states, and I can't even remember how many states that they provide services for now, but it's over 10 or a dozen, I believe.
13 or 15.
Yeah. So we have an agreement across those other state hospital associations where we have a non-resident file, which is basically, it just includes some aggregate data, but those hospitals will begin to show up once the Q1 data is released next week. Those hospital names will be in that hospital dropdown. So if you only want to see Georgia data, then you will need to select just the Georgia hospitals. And an easier way to do that is under one of the filters that's called region. You can just select the Georgia regions, and that will only include the Georgia hospitals. Bill?
Yeah, and it's just going to be some aggregate numbers. It's not going to have nearly the drill down capability that you have within Georgia. So it's just a way that we can try to help some of those border hospitals get a little bit more visibility into what's going on just across their border. But within our program, we already have a number of the border hospitals submitting data to us anyway. So we're not exactly sure how much more information that's going to provide in the dashboards.
And obviously, if you create your own service area by county or zip code, that's only going to include that data, the patients from those areas. So, but we just wanted you to be aware of that, so that when you're filtering and you see those out-of-state hospitals, that's why, is because we participate in that non-resident file kind of sharing. So one thing I did want to mention, and these slides again will be available, and we've had several, I think we've had 2 or 3 office hours outside of our user group, and those have been very helpful, I think, to us and to other people. And Sharif and I have also done a couple of one-on-ones with a couple of different hospitals who had a specific need, and that's been helpful to them, I believe. So one thing that we recommend is that you can make some of your views default views if you want to. Do be careful with that option. At the top of the screen, you can click view, and if it says original, then that really means the default, and no other filters or selections have been made to that view. If you create a view and choose make it my default, then every time you go into that particular suite, into that particular worksheet, then that is going to be the view, whatever you name it, and it's going to say, for example, view maybe Gwinnett County, or view your hospital's name. And that would be a starting template based on, you know, whatever selections you make. But one suggestion has been that you begin with your service area, for example, your zip codes of patients that come, you know, that are in your area, and you could save that as a starting point, so that every time you go into the dashboard, you know that you're going to be looking at your service area for that particular suite. And then you can add, if you wanted to add specific DRGs, if you wanted to add specific demographics like age group, then you can go in and add those other filters. But that way, especially if you have a larger service area with, you know, a larger number of zip codes, you would have a starting place instead of having to add those zip codes every time. Now, of course, if you don't have to make that your default, but you could save that template, so to speak, and then just toggle back and forth. You just click on the view, and it will show you a list of views that you have created and saved. And again, other filters can be added once you create a view to save. Favorites, as you've probably seen and explored, is a great place to go to begin with. If you've made something your favorite, it just kind of is a shortcut to get to where you typically go into the tool. And then also, again, this is the screenshot of how you click on view original, and then it will show you my views. So I did my service area, DRG, care service line. I did a cardiovascular, but when you click on view original, click that, it will show you what other views that you have created. And let's see. Question, can we get a list of the states that participate in the non-resident? Yes, we can get a list of that and add that to the slides once they're published. And will the non-residence hospitals also be added to the limited data sets for Q1? We had not considered that. We're not going to do that. It's not.
I don't think we can. I think
no.
This is just a back-end system that we now have the ability, because we're all on this same common platform.
Right. Right, and it's not the same level of detail at all. It's a completely different data set, so we will not be doing that. Any other questions about the tool Advantage Optics? And then I have something else to add, but I want to pause there. All right, well, our next meeting typically would have been on July the 6th. And as we were looking at our calendars and also receiving all the out of office emails from this week, we thought it might be a better idea to move the week of the July 4th meeting up a week to June 29th. We were considering having an office hour anyway on that day for Advantage Optics, and this way we can even stay on the phone after we finish our business and consider the rest of the user group meeting an office hour if you have questions or want to see anything demonstrated. But we have moved typically the July 6th meeting up a week to June 29th. And then also please note that September's meeting is not the first Wednesday either. It's the 14th due to a conflict internally. And as a reminder, you may want to re-download the email invitation that Sharifa sent out yesterday. Has the updated calendar invite for the reoccurring meeting, and it should move the July 6th meeting to June 29th if you re-download the calendar invite and save that to your Outlook. One other thing I didn't mention at the beginning is that I did send out notifications for the Q1 2022 limited data set release this morning for limited data set users. That is available through Box, and so you should have received a notification if I've received your order form for 2022. Any other questions? Well, we appreciate your time and we're always here for you. So please don't hesitate to reach out if we can answer any questions or give a demonstration of Advantage Optics. We're here and happy to help.